in all the hype and finesse of talking about digital health, that we have to recognize that there are limitations as well, and how do we work together to overcome that? Because there are divides on several levels, I would say. So when we talk about vulnerable, you have vulnerable in a healthcare perspective, so a healthcare delivery divide where the access just simply does not exist in their vicinity, or even in the ecosystem that they're in. This could be people in rural areas. This could be people in even in urban areas, but perhaps just not in the socioeconomic class that allows them to engage as proactively as we would like. Or you also have the digital divide that happens, and it does not necessarily tie to socioeconomic means. I want to highlight this because you have emerging markets that leapfrog altogether, and most of them have phones before they actually do, mobile phones before they actually have anything else, before a TV, before anything else. So it does not necessarily come hand in hand. And so I think when we think about how do we bridge these, for each different use case, for each different divide that we're tackling, we necessarily have to cater accordingly, right? So if, let's say, for example, we're talking about access to healthcare divide, that's something we're already doing. We're working very hard with our B2B partners. So whether or not it's in the form of employers, NGOs, or even pharmaceuticals and insurers, right? These are the ecosystem players, I would say, that are key to really bringing that access, to a wider spectrum. And of course, the healthcare providers are at the core of everything. When it comes to digital divides and socioeconomic divides, education divides, this is where I would say public-private partnerships have to happen in close tandem. Because this is not something that any one party can deal with. In the commercial world, it's a bit different, right? The insurers want to mark their territory, so boom, this is what I do. The pharmas, want to mark their territory for whichever drugs, or solutions that they're advocating for. But when it comes to these kind of issues of bridging divides, no one pharma, no one insurer, no one, I mean, vulnerable communities sometimes don't even have insurance in the first place. They have, whatever the government's giving, and that's about it. And so that's really where I think the private and public sector has to come in together. And that's really where there will be a sense of tension between, like what Jeremy mentioned, right? Those who are going down a pathway of closing up, and then those on a pathway that are opening up. And in that, we will have a different set of divides and vulnerabilities that will emerge, which we will then need to address, right? So I think that's probably in broad strokes, something that we are working very hard with, but it's an ecosystem approach.
Thank you, John. Now, Jeremy, I want to be in the last few minutes. I want to be sort of the devil advocate in a sense, right? So,
yeah, sure. Happy to do that.
Yeah, there are some critics out there. They are looking at this with some skepticism, right? I mean, I know that you're very positive on this, and you've been incredibly active in the chat as well. But some critics, and again, of course, this is an industry that has a number of dimensions that are going in the direction of protectionism, right? So imagine just the local nature of this market and the existence of barrier in entry. So the idea of a monopoly, clearly each medical workforce in essence has that prerogative in its own countries. So if you open up, obviously prices will be affected and so on and so forth. So the bottom line of that criticism is that ultimately will be the decision of the supply side, so the medical professionals. And in fact, they predict that this will all blow over because they want to embrace it, they want to play this game, and so on. So what's your view on that? Is that something that you can really expect globally, or there are some signs for this not to be stopped, or if it is, that it's gonna basically sort of fight back, or if you want, bite back. Thank you, Jeremy.
Thanks. I will make it very quick. There will be an eternal struggle with the combatants locked in a mortal existential challenge, because you're absolutely right. These are rice bowl issues. Medicine has been one of the most protected sectors for a very, very long time, because politicians are prepared to break rice bowls, but they're not prepared to play with people's lives, right? And the medical profession has, I mean, we have traditionally scared politicians that doctors from overseas they will provide poor care, people will die, and you will be responsible for lowering standards. And that's been a very effective argument for a long time. But if I look at private hire like Uber and Grab in this part of the world, I think things are starting to change. People are far more prepared to, I won't say break rules, but to skate in where there are no rules. And it's fairly classic disruptive innovation, Christensen style. Where are folks playing? Joan is playing in the mental health space that has traditionally been unmet or underserved. Another area that's really bubbling up in this part of the world is in sexual health and femtech, right? And again, these are underserved areas, and you realize that the demographic or the market segment are those who are digital natives, those probably 35, 40 and under, and the folks who traditionally don't get good service from the incumbents, right? And basically the tide is in favor of digital transformations. It's a bit survivor-like. We old fogies will eventually die away. We will be replaced by the young fellows who will embrace this and have less concern about whether the service is provided out of Singapore, China, Australia, wherever, right? And we have seen that in every other sector. Why should healthcare be different permanently? Yes, change is hard in the healthcare sector, but I don't think change is just impossible. I think it's very, very possible.